Hi everyone, again Lisha Roy this side. As I am taking all your general surgery topics, so a very important topic I am gonna discuss is your Pott's Puffy tumor. Okay, this is your Pott's Puffy tumor. What happened over here is it is first described by your Sir Percival Pott. It is an subperiosteal abscess associated with your osteomyelitis. It is a subperiosteal abscess associated with your osteomyelitis. Okay. Then osteomyelitis of the frontal bone. As you can see in the picture, it is associated with the osteomyelitis of the frontal bone. Direct or through hematogenic spread. How it spread? It spread through your direct or your hematogenic spread. The formation of the diffuse external swelling in the scalp is due to subperiosteal pus formation and scalp edema. It is due to your subperiosteal. See, this is your periosteum. Okay. So in the periosteum, what it is fill up of? इट इज़ ये एक एक्सटर्नल स्वेलिंग है स्कैल्प में और ये क्यों होता है क्योंकि हम लोग के यहाँ पे सब पेरियोस्टल पस भर जाता है इसमें क्या होता है हम लोग का सब पेरियोस्टल पस भर जाता है और क्या होता है जैसे कि आपको इसमें दिख रहा है हियर वी कैन सी द स्कैल्प एडिमा व्हाट वी कैन सी इज योर स्कैल्प एडिमा ठीक है अब आते हैं हम लोग कि इसका इटियोलॉजी क्या क्या है तो फर्स्ट इटियोलॉजी इज योर फ्रंटल साइनस तो फर्स्ट etiology is your frontal sinus. So what happened in your frontal sinus is there must be any chronic suppurate extends into the subperiosteal region. कोई भी क्रॉनिक सुपुरेट है जो कि हम लोग का एक्सटेंड कहाँ पे होता है सब पेरियोस्टियल रीजन में तो सबसे पहले हम लोग का कौन सा इटियोलॉजी हो गया फ्रंटल साइनस सेकेंड वन इज योर frontal second one is your frontal trauma second one is your frontal trauma okay then third is your chronic suppurative osteitis media chronic suppurative otitis media CSOM or in frontal sinus that will be your post surgical so what are the symptoms what are the etiology first one is your frontal sinusitis second one is your frontal trauma third one is your chronic suppurative otitis media and fourth one is your post surgical after frontal sinus reconstruction now come to the point what are the clinical feature that is your pain then is your bogey swelling and also the pitting scalp edema and also the pitting scalp edema okay so pitting scalp edema now come into your complication so again I repeat what is your clinical feature that is your pain bogey swelling and pitting scalp edema now come into your complication what are the complications are osteomyelitis in the frontal bone as you can see it is happening in the frontal bone so osteomyelitis in the frontal bone as well as intracranial abscess see this is the cranium so this is the cranium there may be any abscess in any of the part so this is your intracranial abscess now what are the investigation the investigation is your total leukocyte count then it might be rising then is your ESR that is also your rising then your x-ray of the skull I have a diagram see this is the x-ray of the skull this is also one type of investigation you can see in the investigation in the x-ray of the skull your osteomyelitis of the frontal bone. See, you can see in the X-ray there is an osteomyelitis in the frontal bone. As well as we can also investigate by your CT scan, as well as we can also investigate by CT scan and your MRI. Now come into your treatment. What will be the treatment, guys? Okay, so the treatment will be, first of all, will be your surgical drainage. First will be your surgical drainage. Then will be your antibiotic. Then will be your cranial cavity neurosurgical decompression or daddy's brain cannula. Cranial cavity, then your cranial, write it properly. Okay, so it is here cranial cranial cavity cranial cavity, see, this is your cranial cavity neurosurgical decompression, or known as your dandy's brain cannula. Okay, so dandy's brain cannula. So here I end up your Potts puff tumor.